Terrific. Okay, good morning, everyone, and welcome to those who've joined us online for this media briefing today. My name is Susanna Elliott, and I'm from the Australian Science Media Centre. Now, before we start, I would like to acknowledge that that I am actually presenting from the lands of the Ghana people, and I'd like to pay my respects to Indigenous elders past, present, and emerging from all over Australia. Now, just a reminder that the contents of this briefing today are all under embargo, and that is until 8:30 a.m. Australian Eastern Standard Time on Wednesday, the 21st of May, so that's tomorrow morning. If you are joining us from overseas, there'll be other time zones, so please check your time zone. So today's briefing launches a major assessment that has been done by the Lancet Commission on adolescent health and wellbeing. And it looked at the health of the world's teens and young adults and making predictions out to 2030 and very much warning that they risk being left behind in a number of indicators of global health improvement. So joining us today to talk about this assessment is a co-author on the report, Professor Peter Azzopardi. Professor Azzopardi is Commission member and leader of the Global Adolescent Health Group at the Murdoch Children's Research Institute in Melbourne. He is also head of Adolescent Health and Wellbeing at the Kids Research Institute of Australia. So there will be an opportunity for you to ask questions of Peter at the end of his presentation, but please feel free to start typing your question as soon as you think of one. Just make sure that you give us your affiliation so we know where you're from. And you can do this by typing your question into the Q&A box or raising your hand at the end of the presentation, and we will unmute you. So I will now hand over to Professor Peter Azzopardi to take us through his presentation. Thank you very much, Peter.
Look, thank you so much. I really appreciate it. And thanks for the opportunity to be with you all today. I'm joining you from the land of the Wurundjeri people, the Kulin Nation, and I equally pay my respects to elders past and present. Look, a terrific opportunity for us to celebrate really what is a launch of a very important report. It's a second Lancet Commission on Adolescent Health and Wellbeing, follows our earlier Commission report in 2016. It's being launched at the World Health Assembly tomorrow, where WHO and country partners from all across the globe are coming together, where they will really look at this report and make commitments to actually advance adolescent health and wellbeing. This Commission report brings together 44 leading experts in adolescent health and wellbeing from across the globe. So different disciplines from different countries. And what's really exciting and really important actually is that it brings together 10 young commissioners as well. So youth engagement is something that we recommend very strongly in the Commission. And we've demonstrated how this can be done well in a number of places through the Commission, including through co-authorship by young commissioners as well. Just to place this in context, so there have been a number of landmark publications in the Lancet which have called for investment in adolescent health, but the reasons why have changed over time. And going back, 10, 15 years, we really talked about the need to invest in adolescent health because of unmet needs that young people, so adolescents and youth are different from children, they're different from adults, and they have needs that aren't met through pediatric or adult services. But what's really shifted over time is that actually investing in adolescent health can improve the health of all of us. It improves future adults. It improves the health of the next generation. And there's a very favorable return on investment. So for every dollar invested in adolescent health, there's a return of almost $10. And so that's certainly the message of this Commission report here, is that we need to invest in adolescent health and wellbeing to ensure the health of our planet and our future. It's important to note that there has been some progress made in adolescent health over time. And so in the 2016 Lancet Commission report, we talked about thinking about the world's adolescents as living in 3 different settings. So there are countries like Australia where adolescents experience predominantly non-communicable diseases, so things like mental disorder and chronic pain, chronic respiratory conditions like asthma. There are some parts of the world where adolescents have non-communicable disease and also a burden of injury, so particularly parts of South America and Eastern Europe. And then there are parts of the world, including in parts of Asia, the Pacific, and in sub-Saharan Africa, where adolescents experience a burden of non-communicable disease, a burden of injury, and an additional burden of communicable diseases. So things like diarrhea, pneumonia, HIV, tuberculosis, those settings being multi-burden countries. And you can see over time that there has been progress made, so there has been a reduction in the number of countries classified as being multi-burden for adolescents. In 2021, coinciding with the COVID epidemic, there was a sort of a sliding back. And so there were some countries that went back into being multi-burden. But over time, and we're projecting to 2030, that we will see more and more countries shifting into having lower burdens of communicable disease, lower burdens of injury, and higher burdens of non-communicable disease for adolescents. But the important point here is that the population growth in these countries is quite different. And we're projecting that most of the population growth is going to be in countries where adolescents experience a multi-burden profile of disease, so places like sub-Saharan Africa and parts of Asia. And so by 2030, we project that half of the world's adolescents will be living in settings where they experience multi-burden profiles of disease. So a real wake-up call that we need to invest in, we need to invest now. So there are three main reasons why we've seen some progress made, but not the degree of progress that we would like to see in adolescent health and wellbeing at a global level. The first is insufficient investment. And so the 2-cent coin signifies that, of developmental assistance in health, for every dollar that's invested, only 2 cents goes to adolescent health. And that's remarkable when you think about that adolescents, make up 25% of the world's population, or they make up, almost 10% of the total disease burden. But the other really significant point is that of this limited investment, it isn't always going to the areas of greatest need. And so particular, we know that mental health is a really big issue for adolescents and young people. And that, as you can see here, receives of this very limited investment, a very, very small proportion actually goes to mental health. Another reason why we haven't seen progress made is that there's a whole range of new drivers of adolescent health and wellbeing that perhaps we haven't addressed as well. So much of our focus has been on outcomes, but we haven't necessarily addressed the determinants of adolescent health and wellbeing. So climate change affects us all, but it particularly affects young people, climate anxiety, but also the direct impacts of climate displacement place young people at unique risk. Rapid and unplanned urbanization. So urbanization brings many benefits for young people, it brings benefits for all of us, but rapid urbanization, unplanned urbanization, where young people are living in insecure housing and are isolated from their peers and their communities, brings significant risks. We've seen great gains made in education over time, but that isn't being matched with post-educational opportunities. And we know that particularly for young women and girls, that post-education, there are limited opportunities for them to participate in further education or the workforce. We know that commercialization, not just of food systems, but in terms of the way that we live our lives, is a looming and huge risk for adolescent health and well-being. We live in a world that is rapidly digitally connected, again, bringing many opportunities, but there's a great digital divide, and there are many young people that can't access digital platforms. And we also know as well that digital platforms can also bring risks to young people as well in terms of harmful exposures. We live in a world where there are at least 4 active wars, and conflict uniquely impacts on young people and displaces them. And we saw, as a result of the COVID pandemic, that these global shocks can uniquely and, significantly impact on the health and well-being of all of us, but particularly on young people. And we're living in a world now where many young people have had their education disrupted as a result of COVID. I think the third reason why we haven't seen the gains made is because we've failed to really engage with young people meaningfully. In the Lancet Commission on Adolescent Health, we undertook a global consultation with young people to really ask them their solutions to some of the pressing issues in the world. And the solutions that young people had, so these are just an example here, were remarkably thoughtful and really challenge, I suppose, some of the approaches that we currently take. So, for example, in terms of addressing mental health, they called for different approaches so that the current approaches that we have, which are predominantly driven through the health system, aren't effective, aren't working for them, and that they really highlighted the need to address mental health literacy and particularly around stigma. So the Commission calls for a new way forward, and our recommendations are really framed around this conceptual framework. So the top half of our conceptual framework really highlights a socio-ecological approach to thinking about not just the outcomes of adolescent health, but the particular determinants and drivers across individual, immediate social context, broader structural drivers, and also global factors as well. And we've highlighted that there are a number of particular exposures that happen at a global country level, such as climate disasters, such as conflict, which impact adolescent health and wellbeing across all of these different levels. And what we've really called for is that, our responses to adolescent health and wellbeing need to truly be multisectoral. And so, in the earlier commission report, we called for investment in health services, the health sector. We recommend that it continues, but it needs to go beyond that. We need to engage with the education sector as well. We need to engage with justice and security. We need to engage with young people. And so this framing is really calling for a true multisectoral approach to adolescent health and wellbeing. We recommend 3 key areas where we need to act to improve adolescent health and wellbeing. So we've called these 3 goals, and there are a series of 15 recommendations that fit under these. And I just wanted to highlight some of the key ones here. The first is that we need to create an enabling environment to transform adolescent health and wellbeing. So we need to meaningfully engage young people. There has been a shift towards engaging young people, but we need to, seriously invest in the way that we engage with young people to harness their unique perspectives and skills to help build a better future for us all. We need to develop a specific sustainable development goal, and particularly in the post-sustainable development goal era, beyond 2030, that focuses on adolescent health and wellbeing. We currently have 17. None of them speak to adolescents or young people, despite them being a third of the world's population. We need to measure, we need to report adolescent health and wellbeing so that we ensure that the needs of young people are front and center, but we also we ensure accountability in terms of what we do, that we're measuring what progress is being made. And we need to match financial and human resources to the needs of young people as well. The second set of recommendations is really around strengthening actions within existing sectors. So we need to strengthen what we do within the health system for adolescent health, but we need to move beyond the health system, and we also need to ensure that the education sector, where many young people spend a great proportion of their day, is supporting the well-being and the development of young people as well. We need to ensure that young people are protected from violence, harm, and incarceration. And we need to also strengthen broader opportunities within the community to assure their well-being. And the third set of recommendations is really around, innovative approaches. So this is, moving beyond what we currently do to really ensure adolescent health and well-being. So we need to address the commercial determinants of health. So particularly, advertising that targets young people, the commercialization of food systems. We need to promote evidence-based use of social media. Social media is the way that many of us connect now with each other. There are harms, but there are also benefits of social media as well. And so we need to really grow the evidence base and ensure evidence-based policy and programming. And we need emergency action on the climate crisis as well. So this Lancet Commission report is a call to action. Our tagline is that the investments made in this generation of adolescents will determine our human and planetary futures for good or for ill. And the time to act is now. This is the largest population of adolescents that we have ever seen and likely to ever see. And so I think that, certainly this is the time to act in adolescent health. I just wanted to finish up with a brief video that we've prepared with WHO and the Lancet, which, captures again some of those key messages, but, perhaps presents them in a slightly different way.
Adolescents are the future leaders of our world. Ensuring their health and well-being now and into the future is key to building a just society and a thriving planet. But are we doing enough? As we move towards and beyond the Sustainable Development Goals, we must prioritize adolescent health and well-being. The second Lancet Commission on Adolescent Health and Well-being has convened a global, multidisciplinary, and multi-generational group to tackle this critical issue. This generation is facing unprecedented challenges, from climate change to digital risks, conflict, and displacement. Today's adolescents are the first to experience lifelong climate change impacts. By 2100, 1.8 billion adolescents will live in a world projected to be 2.8 degrees Celsius warmer than pre-industrial times. The risks are real and rising. There has been progress, including reducing communicable diseases and improving education outcomes. But without increased investment, more young people will face declining health, with growing rates of obesity and mental ill health. Despite progress in some areas, our projections suggest that the SDG era will end with at least half of the world's adolescents, 1 billion, living in multi-burden countries where adolescents experience a complex and excess burden of disease. These will have lifetime and intergenerational impacts. Investing in adolescent health provides a triple dividend: benefits for young people now, for the adults they become, and for the next generation. Yet, global funding remains insufficient. Adolescents living in aid recipient low and middle income countries receive only 2.4% of total development assistance for health, despite making up 9.1% of the total burden of disease and representing a quarter of the population. Yet, there is hope. Education, economic growth, and digital innovation provide opportunities for even the most marginalized adolescents. School health initiatives and transformative public policies are paving the way for a healthier, fairer future. With the right investment and leadership and meaningful participation, young people can help reimagine a better world. For example, Bogota, a city in Colombia, introduced traffic calming measures based on traffic data analysis and road inspections to improve student safety commuting to school. Nepal's National Reproductive Health Strategy included a specific focus on adolescents. It aimed to increase access to health services, including counseling. Critical for success, the policy incorporated the perspectives of adolescents. The First Lady of Benin has championed ending female genital mutilation and cutting, joining First Ladies from Burkina Faso and Niger in 2017 to condemn this practice. The investments made in the generation of adolescents will determine our human and planetary futures, for good or for ill. The time to act is now. Together, we can make it happen.